name is Amy Maloli. I'm the certified hand therapist and occupational therapist here at the Hand Center at Muskegon Surgical Associates. Today I'd like to talk to you about the therapy path patients who have had a metacarpal fracture go through. Metacarpal fracture is a fracture of one of these bones in our hand. These are the bones down at the base of our hand. Oftentimes we see the little finger or the ring finger fractures. In therapy, we will see you about 7 to 10 days after your surgery. Oftentimes that surgery involves putting a plate on these bones or sometimes having pins in the bone. And that's up to the surgeon what they end up doing, but therapy tends to be a little different for each repair. On the first day of therapy, you'll still have your post-operative dressing on. We'll help you take that off. We'll get your hand washed up and do an assessment. We'll see how your range of motion looks, how your sensation is, if you have any numbness or tingling, and we'll measure the swelling so we can track as that goes down. We'll also make you a custom splint to help protect your fracture and your repair site. So your splint often will look just like this. What we'll do is we'll slide it on. And you'll still be able to use your first 2 fingers, but still protect that fracture site. Once you get to about 4 weeks out from surgery, we'll be able to cut the splint down, so you'll be able to move your wrist, but you'll still have some protection for that fracture site. For therapy, we tend to see you 1 to 2 times a week and progress with getting your joints and hand moving better, watching how that swelling is, and once we hit the 4 to 6 week point after surgery, we'll work on getting some strengthening activities going. Therapy typically lasts 6 to 8 weeks after a metacarpal fracture. That's a typical course. If there's something else that's going on or another injury added on top of that, the duration of therapy can be a little different. If you have any questions before your surgery or after your surgery, please feel free to give us a call here at the Hand Center at 231-246-2440.